So the next topic we are going to discuss is distribution of drugs. Under the pharmacokinetic parameters, that is A, D and E, we have discussed in last videos about absorption and all the mechanisms and the factors affecting the drug absorption. Today we'll start with the distribution unit. Now what is distribution? Once the drug is absorbed and enters into systemic circulation, the fate of drug is known as disposition. So the disposition of drug includes distribution, metabolism and excretion. So among that, first is distribution. Now the drug enters from the site of administration to the systemic circulation, that is in blood. Now from this, blood will be flowed to different organs like in heart or liver, brain or any other organs. This is highly perfused organs and for the less perfused organs. So the drug will be distributed from the blood to different organs. That is known as distribution. So distribution, how to define this distribution? It is a reversible process because all other process is not reversible process except this distribution. It is from blood to drug reaches different tissues and from tissues it can go back to blood. So it is known as reversible process. So distribution is such reversible process where the drug moves from the blood to different tissues, that means organs, and then to different body fluids. Apart from blood, we have so many body fluids like synovial fluid, cerebrospinal fluid, salivary fluid, extracellular fluid. So there are so many body fluids. The drug distribution from blood to this body fluid is also distribution, and also to some restricted membranes like blood-brain barrier and placental barrier. So the drug can distribute to these areas. That is, the drug from blood, it can distribute to various tissues, to other body fluids, and also to some restricted barriers like blood-brain barrier and placental barrier. So we will discuss about all these three distribution. First of all, distribution of drugs to blood and body fluids. The drug will be distributed inside the blood as well as to the body fluids. The drug, when it enters the blood, in each minute the blood flow will reach the heart and it will be pumped from the heart, whole blood. It is 6 liters of blood will be pumped by the heart, and all the blood will be circulated throughout the body. When blood will be circulated throughout the body, the drug present in the blood also will be distributed throughout the body. So initially the distribution of drug, once it enters the blood, it will be distributed within the blood as well as to some body fluids. So the drug which will enter into 6 liters of blood and can permeate through blood cells will have volume of distribution of 6 liters, because the drug can easily accessible to the whole blood, that is about 6 liters. The whole volume of blood will be distributed by this drug. It can also permeate through the blood cells like RBC. It can enter the cell, then it will have the volume of distribution of about 6 liters. But if the drug will be restricted only to plasma, that means when it cannot permeate through the RBC, when the drug cannot enter the membrane, then it cannot enter into the blood cells. So its volume of distribution will be 3 3 liter. Why 3 liter? It is the plasma volume. So when the drug permeates through the RBC and when it distributes uniformly throughout the systemic circulation, will have volume of distribution of about 6 liter. Whereas those drugs which will have restriction in permeation through the red blood cells will have volume of distribution of 3 liter, which is the volume of plasma, because the drug will be confined to the plasma. It cannot enter to the blood cells. So it will have volume of distribution of about 3 liters. And what about the blood capillaries? The drug can permeate easily to all the blood capillaries except the blood capillary that is present in brain because of presence of blood-brain barrier. So only the brain capillaries are not permeable. Other than that, most of the blood capillaries are permeable, so the drug will be uniformly distributed through this blood capillaries also. Now considering the body fluids, I mentioned already. So what are the body fluids that is present other than blood? Blood is the major body fluid present in the body. Other than that, apart from blood, we have synovial fluid. This is the fluid present in the joints, like in elbows and in the knees. We have synovial fluid, the fluid present in the joints for lubrication purpose. And we have CSF, which is cerebrospinal fluid, saliva, that is also another fluid present in the body, bronchial fluid present in the lungs, and pericardial fluid present in heart, and the middle ear fluid. So these all are some fluid present in the body fluids other than blood. Now how the distribution will be there? So in case of synovial fluid, in case of saliva and CSF, the blood volume will be, that is concentration of drug, mainly free drug, will be similar to that of that is present in blood concentration. So the drug concentration, especially free drug concentration that is present in the blood, will be equilibrated with the free drug that is present in saliva and CSF, since proteins are less as compared to blood. Here protein binding may take place. So in case of blood, plasma, proteins are present. So the drug has some affinity to bind with protein, that is known as plasma protein. So that is possible in blood. Some drugs may exist which are not bound form, can exist in free form. Only that free form that is present in blood can get equilibrated with the saliva and CSF. So the free drug concentration present in blood will be equilibrated with the free drug concentration present in the CSF and saliva, because there are less proteins or negligible proteins or no proteins in saliva and CSF. What about synovial fluid? The drug concentration in this fluid will vary according to the disease, because the synovial fluids albumin concentration will vary depending upon the inflammation and arthritis, some other diseases like malignancies, renal disease, hepatic disease. In that cases, the proteins present in synovial fluid will vary, because of which the concentration present in this fluid also changes according to the diseased state. And the concentration of drug in extracellular fluid, again it will be less than the volume of plasma, that is blood, less than 6 liter. It will have ECF volume of distribution of drug. So how the drug will be distributed within the blood? If the drug which can enter the red blood cells will have volume of distribution of 6 liter, and if it cannot permeate through the membrane, then will have 3 liter. Then in blood capillaries, freely they can move except the blood capillary present in brain. And in case of body fluids, saliva and CSF will have similar drug concentration like that of the free drug concentration present in blood, because saliva and CSF lacks plasma proteins. And synovial fluid, there the blood drug concentration varies in diseased state. It may change with the diseased state, mainly in the diseases like arthritis, joint pain, inflammation, renal and hepatic diseases. This is about the distribution of drugs to blood and body fluids. Now, how the distribution takes place in tissues, also known as cellular distribution. So, what is cellular distribution means? The distribution of drugs from blood to drug distribution from blood to different organs. Organs are made of tissues and tissues are made of cells. That is why we are studying about cellular distribution of drugs. So cellular distribution of drug is also similar to that of oral drug absorption. So those factors which will affect the oral drug absorption will have effect in the cellular distribution. Why? Oral absorption also takes place through the membrane. So what all the mechanisms which will affect the movement of drug through the membrane will also affect the distribution of drugs. Like we already know, lipophilic drug and small hydrophilic drugs will have passive diffusion of drug absorption, and large hydrophilic molecules will have carrier mediated transport. Through that, distribution will takes place. So the molecules which are lipophilic and small hydrophilic undergoes distribution by this mechanism, that is passive distribution, whereas large hydrophilic molecules will have distribution by carrier mediated transport. As well as weakly acidic drugs will have weakly acidic, and if the drug is weakly basic in nature, then its pKa, pH of blood will play an important role. That is, in case of either weakly acidic or basic drug, their distribution will be depend upon its unionized nature and its lipophilic nature. Like in absorption, I said in pH partition theory, only unionized form and lipophilic form absorbs more, permeates more. Same here also, permeation through the membrane takes place. So unionized and lipophilic molecules permeates more. So if the drug is weakly acidic and weakly basic, it depends upon the pKa and pH of blood. So let's consider about an example, that is barbiturate. You might be knowing barbiturate is an example for sedative and hypnotic. Take example of phenobarbital. So this drug is, what is the nature of this drug according to pKa? It is weak acid. You might be knowing it is the salt of barbituric acid. Barbituric acid, so it is a weak acid. So barbiturate is weakly acidic drug, and this may cause poisoning because this drug is acting as a sedative and hypnotic, means they act in the central nervous system. So when the concentration will be more in brain, they may cause toxicity. So we can change the pH of the blood, and we can just use for the treatment of barbiturate poisoning. Let's consider the drug is weakly acidic drug, that is barbiturate drug. When it is placed in the blood whose pH is acidic pH, that means we are inducing acidosis. Acidosis ka matlab, what is meant by acidosis? Acidosis means induction of acidic environment, acidic pH, stimulating the acidic pH of the blood is known as systemic acidosis. How can you induce acidosis? By injecting carbon dioxide. Just inject carbon dioxide gas or infuse carbon dioxide gas in the blood will lead to reduction in pH, or acidity will be increased in blood. Acidosis will be induced. So when you induce systemic acidosis in blood, now blood is acid and this drug is also acid. Acidic drug in acidic medium will be in unionized state. Acidic medium will have unionization, will lead to permeation of the drug through the membrane. So the drug can permeate through the membrane and it cannot weakly acidic drug when you induce acidosis. So acidic drug in acidic medium, it will be unionized in nature and it will permeate and it will reach the liver, kidney, everywhere. Now what happens? The drug will have toxicity, even it will reach the brain. So if you induce acidosis in case of acidic drug, like in case of barbiturate, it will reach all the tissues or the cells inside. So it will cause more toxicity. So in case of barbiturate poisoning, how to reduce the toxicity? So for that we have to do the opposite case or the reversal case. That is, we have to induce alkalosis. How to induce alkalosis? Is by injecting sodium bicarbonate in blood. Now bicarbonate will increase the pH and makes the blood alkaline. Now the drug is barbiturate, that is weakly acidic drug. When it is placed in alkaline pH of blood, this will get ionized. So the ionized drug cannot enter into the membrane. So it will be present only in the blood but not in the organs. It cannot distribute from the blood to the organs, because to move from the blood to the membrane, through the membrane, it must be in unionized in the case of acidosis, like in case of acidosis. But in case of alkalosis, since it is ionized in nature, ionized cannot permeate through the membrane, so it will retain in the blood itself and it will start circulating in the blood and will reach kidney. And once it reaches the kidney, what we can do? We can go for urinary alkalosis. Initially what we did? We did systemic alkalosis, that is, we made blood alkaline, that is known as systemic alkalosis. Now you are making the urinary alkalosis. So urinary alkalosis, what it does? When the drug reaches the kidney, where the drug is ionized already and urine is also, now you have made the pH of urine to be alkaline. Now the drug, acidic drug in alkaline urine, again it will become ionized, and we know that ionized form is highly water soluble form. So urine is water. So the drug which is ionized will get soluble in water and it will be excreted through urine. When urine will be excreted, this barbiturate will also excrete through urine. So this is the importance of this ionization nature of the drug. So the drug, weakly acidic drug, we consider barbiturate, which is a weakly acidic drug. When you make the blood acidosis, that is, you induce acidosis in blood, that is, when we make the blood acidic in nature, the drug will be unionized, may lead to distribution of drug in whole organs, tissues and cells, may be toxic to the body. But when we make the blood alkaline in nature, the drug will become ionized, so it cannot permeate through the membrane and it cannot distribute to the different organs, tissues or cells. It will just try to excrete out from the body. And now how to excrete? Now promote the excretion of drug. Now it is present in the body. Now you have to throw that drug outside the body. Now what we are doing? Now make the kidney alkaline again. Now when you make the urine alkaline, that is, you are inducing urinary alkalosis. These alkalosis can be induced by sodium bicarbonate. Now the urine is also alkaline. Drug is acidic. Acidic drug in alkaline medium will be ionized. Ionized form is highly water soluble. Urine is water. When you place this ionized drug in water or urine, that drug will also get dissolved. Now the dissolved drug through urine, it will get excreted out, thrown out of the body. So it can be used in the barbiturate poisoning. So distribution of drugs also will be affected by unionization and ionization. So if the drug is ionized, it will distribute more faster. If it is unionized, it will be excreted out from the body. This is all about cellular distribution of drugs. Now lastly, the distribution of drugs to restricted membranes, that is blood-brain barrier and placental barrier. So first is the distribution of drugs to blood-brain barrier. We know already all the drugs which are administered distributes evenly throughout the body, but it cannot permeate very freely in brain, because brain is a vital organ. It controls all other organs in our body. So naturally there is a barrier which is present in the brain, that is blood capillaries with cellular sheath. It has an extra protection of having cellular sheath which restricts the movement of, means it stops the entry of drug to the brain. There is a traffic barrier. Traffic police is standing here, which is blood-brain barrier. He is standing here. There is a barricade which will not allow the toxic substance or all the drugs to enter to the brain. That barricade is known as blood-brain barrier. So, what type of molecules can enter this barrier? So, lipophilic molecules and highly unionized molecules can pass through this barrier. So, lipophilic molecules and unionized molecules can pass, but hydrophilic as well as ionized molecules have restrictions in passage through this blood-brain barrier to the brain. So, the disease like meningitis, this is the disease, that is inflammation in the brain. Meninges are the membrane present in the brain, and meningitis means inflammation in brain. So you need to treat this disease with antibiotics which are polar in nature, have permeation issue. If you need to treat the inflammation inside the brain, the drug have to permeate through the blood-brain barrier. But in case of meningitis, antibiotics cannot permeate. It will circulate in the blood, but it will not enter into the brain. Now, what is the use of using these anti-inflammatory or antibiotics in brain? It doesn't enter into the brain. It will not show any action. So, in that case, what we have to do? We have to disrupt this barrier. We have to break this barrier. Now, how all we can break this barrier? Either use dimethyl sulfoxide, that is a solvent used to break this barrier. But this may have some safety issues. If you break, this may get permanently broken. So that barrier may not be barrier after the treatment of the drug along with this DMSO. It will break the barrier and it will allow the drug to enter in. But this barrier will be permanently damaged. Then after the treatment, any drugs has possibility to enter through this barrier. So, DMSO treatment may not be that much suitable or appropriate in case of disruption of blood-brain barrier. So, we can go for some temporary disruption of the barrier that can be done by osmotic disruption. That is, by using some hyperosmolar solution, we can create osmosis and we can disrupt the tight junctions or the barrier, and we can make the drug molecules to enter through the barrier. And other thing can be done is that we can just loosen the connective tissue. Connective tissue can be loosened, or the tight junctions present in the brain barrier can be opened, or the safer method of administering the drug to the brain by, even if it is hydrophilic, that is modification of drug to prodrug. Prodrug, that is lipophilic form of prodrug, can be used, that can permeate through the membrane, and after entering, on reaching the site of action, through some enzymes it will get metabolized into active drug and will show their therapeutic action. So the prodrug form will be suitable form for administering the drug, which will have restriction in passage of drugs through this blood-brain barrier. So Another common example, we can talk about the Parkinsonism disease. So for Parkinsonism is because of the depletion of dopamine. So when there is less dopamine in brain, what is the reason for Parkinsonism disease? We might have heard about this Parkinsonism and depression, and then we have Alzheimer and brain cancer. So many brain related disorders are there which needs drug to reach the brain. So one such disease is Parkinsonism. So for Parkinsonism disease, what is the reason for Parkinsonism disease is depletion of dopamine, that is less concentration of dopamine in brain or low concentration of dopamine in brain. Now what we have to do, we have to administer this dopamine in the brain. So anti-Parkinsonism treatment will be done by providing dopamine to the brain. But the problem is this dopamine is hydrophilic in nature or polar in nature, which cannot permeate through the blood-brain barrier. Blood-brain barrier cannot allow the hydrophilic dopamine to pass through this and let it to enter the brain. So what we can do? We can give the prodrug. As I said, prodrug is the best form. So we can make the prodrug of this, which is levodopa. So levodopa, which is the precursor of dopamine, can be administered, which inside the brain may convert into dopamine and may show its action. So this levodopa have to convert into dopamine by decarboxylase enzyme. So the enzyme responsible for breaking down of levodopa into dopamine is decarboxylase. But the problem here it is, levodopa is lipophilic, that's why it can permeate through the membrane, blood-brain barrier. But the problem with this decarboxylase enzyme is that is present outside the brain also. This is the blood-brain barrier and this is brain. Brain has this decarboxylase enzyme, and outside this blood-brain barrier in blood also we have this decarboxylase enzyme. So when we administer levodopa before entering into the blood-brain barrier, when it is exposed to decarboxylase enzyme, before entering itself it can convert into dopamine. So that again the usage of this levodopa also becomes useless in the treatment of Parkinsonism. Now what we can do? So we are adding carbidopa. So what is the role of carbidopa? Carbidopa has no role in therapeutic action of Parkinsonism disease. It is used as a adjunct therapy. That means not even adjunct therapy, it is used adjunct to this levodopa. Levodopa gets metabolites outside the blood-brain barrier. To prevent that, we are using carbidopa. This carbidopa's mechanism is decarboxylase inhibitor. So this carbidopa has the ability to inhibit the decarboxylase enzyme. So when levodopa given along with the carbidopa, you might have studied in ecology as well as in medicinal chemistry. For Parkinsonism, levodopa has to be given along with carbidopa. So why this combination is given is, levodopa is the precursor of dopamine and carbidopa is used to inhibit the decarboxylase enzyme present outside this membrane, that is blood-brain barrier. So here this levodopa will not be converted into dopamine because of this carbidopa, but carbidopa cannot enter inside brain. Only levodopa enters and levodopa gets metabolized here into dopamine and it will show action in Parkinsonism. That is the role of the combination of this drug. This is all about the blood-brain barrier. Now the distribution of drugs like this, it will be affected in brain and through blood-brain barrier. Now the last barrier where the drug distributes is the placental barrier. So what does it mean, the placental barrier? The barrier separating the fetal blood capillary with that of maternal blood capillary. So the barrier, this is the barrier which separates the fetal blood capillary and maternal blood capillary. Fetal blood capillary means it is the baby which is present inside the womb of a mother. The nutrients which all taken by the mother will reach to the fetus through this placenta. So placenta provides nutrients and that acts as a barrier also. It will allow only the restricted molecules to enter through this placental barrier. So the barrier which separates the fetal blood, that is baby's blood, with mother's blood. Mother's blood matlab maternal blood. Baby's blood is fetal blood. So the barrier separating fetal blood and maternal blood is the placental barrier. There are so many moderate lipophilic to moderate lipophilic molecules that can enter through these barriers. Example, sulfonamides, some antibiotics, barbiturates can enter through this placental barrier. When we started thinking about this placental barrier, why we have to think about the distribution of drug through this placental barrier? It is because of thalidomide tragedy. There was a tragedy which has been occurred to the baby because of this drug thalidomide. Means when mother took thalidomide during her pregnancy, the babies which were born because of distribution of this thalidomide drug from mother to fetal blood, they had phocomelia, which is known as limb abnormalities. Hands will be short without the fingers and all, and the legs will be short. Limbs will be having so placental barrier I will complete in next video, and volume of distribution. Since volume of distribution is short, so I can continue with the placental barrier. So the after cellular distribution, the distribution of restricted membranes, drugs to restricted membranes like blood-brain barrier as well as placental barrier will blood-brain barrier has been already discussed, but the placental barrier will be discussed in next video along with apparent volume of distribution. So the continuation of that video will be in 2 or 3 minutes. Classes are left. Since it is a long video, that's why I am continuing with the next video. So placental barrier of drugs will be discussed in my next video along with volume of distribution. So the students who have issues in Hindi or Tamil, please kindly comment to me. If you need classes in Hindi mixed with English, also in Tamil mixed with English, I can make it your classes. So just comment to me if you have any issues in English. If you need in Hindi or Tamil, I can make it in my next videos, in forthcoming videos. So just let me know through the comments. Thank you.